Hello everyone. Today we are going to see together drugs' effects on diabetes. So all we know that diabetic patient is like a normal person. He can be affected by different disease and we have to give him different medicines. These medicines can be categorized into three types according to their effects on glycemia. We have some medicines that decreased glycemia, others increased glycemia, and the third kind without any effects on glycemia. But first of all, we have to know insulin secretion mechanism. So glucose go inside cell through GLUT2 receptor, then it will be metabolized to produce energy. This energy close potassium doors, which lead to depolarization of cell walls and open calcium channels, which lead to insulin secretion, then insulin go through blood to act in different organs. But we have also to know two particularities of diabetic patients. We must ensure the proper functioning of kidney and liver, because both of them provide drug clearance and both of them participate in new glucogenesis, which means synthesis of glucose from different systems, and both of them can be affected in long-term evolution of diabetes, which means chronic kidney disease related to diabetes, diabetic nephropathy, and NASH, which means non-alcoholic hepatic steatosis. So we start with medication that decreased glycemia. The mechanism included is increasing insulin secretion. We have a long list like painkillers like paracetamol, aspirin high doses, and some antibiotics like ciprofloxacin and sulfamethoxazole trimethoprim called Bactrim. And we have some antiarrhythmics like dizoperamide and plaquenil, or called also hydroxychloroquine and Lariam, used against malaria. We have others used against depression called ISRS, which means inhibitors of serotonin recapture system, and TRAMADOL, which is a painkiller. Both of them induces hypoglycemia by increasing insulin secretion and directly through serotonin mediated mechanism. We have some treatment used against high blood pressure called ACE inhibitors, ACE, which means angiotensin conversion enzyme inhibitors, and like captopril and enalapril. Both of them are used to fight high blood pressure and to protect diabetic kidneys, and mechanism included is increasing insulin sensitivity. We have also non-cardioselective beta blockers used against anxiety disorders and to slow heartbeat. Mechanism included is enhancing insulin sensitivity. So now we are going to see medications that increased glycemia, and the first one is corticoids. Mechanism included insulin resistance, and you have to know that corticoids are used for inflammatory disease, whatever the site of inflammatory process. We have also drugs used against high blood pressure, hypokalemic diuretics. So the mechanism, as we have seen before, that potassium is important for insulin secretion. So with hypokalemia induced by diuretics, we will have a decrease in insulin secretion. And you have to know that hydrochlorothiazide and furosemide are used also to control blood pressure and to protect kidneys. We have also neuroleptics. The mechanism is insulin resistance, and neuroleptics are used against psychotic problems. We have beta agonists used against asthma and respiratory problems, and the mechanism is insulin resistance. You have two kind of pumps. You have the red one and the blue. The blue is Ventolin and the red one is corticoid combination. You have also immunosuppressant. The mechanism is decrease in insulin secretion, and they are used against autoimmune disease like cyclosporine. They are used against lupus. And now we are going to see statin and contraception pills. You have to know that statin is used to prevent cardiovascular risk, and contraception pills are used to organize pregnancies. So the mechanism is insulin resistance. In conclusion, the necessity of taking the drug under doctor's prescription is important, especially if it is about diabetic patient, and we have to be careful as there are interactions between drugs prescribed against different disease and anti-diabetic drugs. And at the end, awareness with several self-check of glycemia may prevent both hyperglycemia or hypoglycemia, which can lead to death. And I will finish by this short story about diabetic patient who buy some painkiller and aspirin from a pharmacy, and when he was going to his home by driving his car, he made a car accident. So the problem was that this diabetic patient, has a chronic kidney disease, and pharmacy seller hasn't asked him about this problem, and he gives him this medication without any questions, and this lack of questions and of means asking patient of his condition and giving him medication without doctor prescription may lead to death.